Hey everyone, welcome to another episode of the podcast. Today we're in Toronto, at University of Toronto. Very excited to have Jack Norton with us today. I'll let Jack introduce himself briefly, and then we'll get the ball rolling.
Cool. Well, thanks for having me. I'm Jack. I work here in Toronto at U of T for the Creative Destruction Lab, which is a program to support the most promising deep tech ventures around the world in their journey to grow and be successful. Try and find high impact technologies and help them realize that potential. And so it's been a lot of fun. I've healthcare background, biotech background, chased my interests, and here we are. So
awesome. So for those of you who don't know, Jack and I went to the same high school, just kind of down the road, UCC. So it's good to kind of reconnect with him.
Happy to.
Jack, to start things off, for the audience that are not really familiar with the Creative Destruction Lab, can you just give us a quick overview of what the CDL do and how it supports its venture companies?
Yeah, so I'll give the full scope because CDL as a program covers a lot of ground. Maybe I'll start with how we were founded and the story of CDL. So I think it helps kind of cover it all. So in 2012, professors here at U of T did a study around the world of why are certain ecosystems better at commercializing really hard technologies, deep tech, science-based companies in healthcare, climate, AI, computing, agriculture, who knows. But these ones that take a lot of work in the lab and have a lot of technical risk, why are they being more successfully scaled into big companies in certain areas, particularly Silicon Valley, particularly Boston? What do they have that other places don't? And they did a whole study on this, basically being what's missing? And the three things they analyzed as their hypotheses were the quality of technology. Is there better research being done at these places? The access to capital. So is there more money to go around? Are there more willing investors? What is it exactly? Is it money? And then the last one is it advice or judgment? And what is missing? And they landed on the latter. So turns out there's good research being done everywhere. Toronto as an individual hub has some top quality research in all of the science areas, AI, healthcare, really, really high quality IP and papers being published. Access to capital also isn't a huge issue, whether it's granting, whether it's early stage investors, angels, who knows. There's enough of a concentration of that across all ecosystems that you can find it. Yes, there's more money in the valley, but that's not really the deciding factor. What they realized that was missing was judgment. And so they wanted to create this, marketplace for judgment, for advice, for you to go to be I don't know what I'm doing. I've never built a company before. I want to ask people who've done it before how to help me navigate these problems. What should I do given X scenario? And in Silicon Valley, you could go down the street, knock on a door, and you'd find you could knock on 5 doors and have 5 people who've built billion-dollar companies that can help you with that question. I mean, it's not as simple as that, but really concentrated area for that, and a pay-it-forward mentality that was built there to kind of provide that back, because everyone needed help at some point. So CDL was built to be can we just manufacture that advice-giving ecosystem here? Toronto was the case study, and it worked really well. We started by just bringing in local, successful business people, people who've scaled big companies and exited locally, entrepreneurs, people who have some funds under management, early-stage VC who've bet big and won. And then really promising deep tech from U of T and from Waterloo. And that was year one. 7 mentors, 8 mentors, and 5 companies. Wow. And let's just give it a go. And now, over the years, it's proven to be so successful that it grew to more sites, more locations, 13 locations around the world now in 7 or 8 different countries. I should know those stats. But,
wow.
And I think the total value raised by CDL companies that have left the program is upwards of $30 billion of equity value created, which is the number we use. Over time, we realized if we're going to give advice, the way to do that best is to concentrate judgment in certain areas. A company developing AI models doesn't need the same advice as a company developing a new drug. How can you actually specialize the rooms to provide these companies with the best judgment? And so that's how what we call our streams were formed. It's slowly honed in to build new rooms of really specialized judgment for companies that need specialized judgment and advice. And so can 100%. You collect people with experience in a certain area and then present companies that need that type of expertise. And that's kind of what we've gotten to today.
Awesome. Because one thing I've seen with incubators and accelerators, going back to your point, is they're way too general. For example, like a company like Techstars, for example, it's a great incubator, but maybe they take a more generalist approach in that judgment, especially in the biotech field, might not be as specialized as you mentioned.
Yeah, 100%. I think the one thing CDL does on that note too is like we have no prescription to the companies. We don't give any homework. There's no boot camp. There's no one thing that everyone needs to do. Right. We don't have, pitch deck week. We don't have here's how you need to do your IP crash course. There is a place for those that people need it, but we tell the companies to bring us their challenges and then we'll present them with tailored advice to that. They come to us. Everyone has their own expertise, their own strengths, their own weaknesses, their own challenges. Right. Bring those to us and we'll help you with those. We don't want to push anything onto you. You come to us with what you need. Yeah. And then we'll go from there. The other thing that kind of differentiates CDL amongst the marketplace of early stage support for companies is that we're a no cost, no fee, no equity, no nothing. We don't take anything from the companies other than time. Yeah. We think companies need as much of time, money, and equity as possible. Hold on to as much as you can. So time is the one thing we'll spend together. Both our mentors give time, our companies give time, we all give time. Yeah. We're trying to be really efficient with that as possible. So it is at its core, trying to give as much and create as much value as efficiently as possible. Yeah. So being that nonprofit too, we can take chances on companies that might otherwise be too risky. Yeah. We want to go for that really high impact potential. This company might be passed on if you need to make a return. So the incentives are just let's actually go make a difference. And everyone coming in wants to see these companies succeed too.
For sure.
Yeah.
I'm just trying to understand, for example, if I'm a founder working with the CDL, what's the communication like between the company and the CDL team? Is it if I have a challenge, I just shoot you, Jack, a message, and then you and your team will sit down with me and we'll try to tackle this problem together? Yeah. What is that? Because you mentioned it's very case by case. There isn't much structure, but maybe that is the benefit of CDL. But I just try to understand what's the mechanism for communication here.
Yeah, good question. Yeah. CDL has, I guess, there's two sides to that question. The venture, as a founder, the founder experience, it kind of starts right around now, it's July, and runs through till next June. So it's kind of an annual cohort we run. Once a company's into the program, they're paired with what we call a venture manager. So someone on our team, like me or like my colleagues, who gets paired with each company. Each company gets one of us to be their liaison to communicate with the program. So everything to do with preparing for the mentorship sessions that we have, and I'll get into that in a sec. Yeah. And all of the documents and communications and how to roll out their own communications to the CDL community. Their program experience is facilitated by one of our team. Right. In addition to that, the CDL program itself is a series of mentorship session days, we call them. Yeah. And there's 4 of them spread out throughout the year. So we have 4 days where everyone comes together, all of our mentors and all of our companies, to hash it out, to have one-on-one, two-on-one conversations, to really get into the weeds, to solve problems. That's where you bring your challenges. Yeah. We prepare companies on our team how best to communicate their challenges on that day to the mentors who they'll be meeting with. And then when they meet those mentors, they can just hit the ground running. Wow. And so we have those 4 days. They're typically 2 to 3 months apart. And each of those days, companies come in. We have a series of meetings throughout the morning to meet with groups of mentors. So one company, 2 or 3 mentors, 30 minutes. Yep. Kind of have 3 or 4 of those meetings throughout the morning. So you get a couple hours of very hands-on mentorship with specific folks who have been matched based on your problems. Got it. So if you are I really need help fundraising, we're coming towards the end of our runway, and we're trying to really get our round going. We'll be okay, fundraising is number one. Then let's have you meet with VC, angel investor, family office, or pharma investor. If your problem is, I really need help with my IP strategy. We are stuck in the university and tech transfer. Then we'll go IP expert, university liaison. So we'll match you based on what you need. And then that's the kind of first part of the day. It's really hands-on. Then we break for networking and lunch. Bring everyone back in the afternoon. sit all of our mentors down in an auditorium, literally here at Rotman in the basement or in the business schools that we run. Sit all the mentors down in a huge like Dragon's Den style auditorium, and one by one the companies go up and are talked. We have a moderated discussion amongst the mentors with the company for about 10 to 15 minutes, where all 40 mentors are just discussing one company, trying to get them collectively. Can we get them to the top 3 things they need to do before we meet again? Wow. So the goal of the day is, with that in the morning and in the afternoon, can we collectively help you set the 3 most important goals? You bring us yours, we'll like agree, disagree, modify, maybe and say why, and then have them leave with, if you do these 3 things by the next time we meet, you're clearly on the right track, and then we'll reset that again. And we run that experience of like goal setting, mentorship, goal setting, and then like go execute, and we run that 4 times throughout the year. Yeah,
that's gold.
So that's kind of and then in between the sessions, because again, I'm just giving the whole spiel. Depending on what the goals set by that company are and by the community, the like agreed upon goals that they leave with, the mentors in the room will self-nominate to help with that. Right. So let's say you think your biggest goal is fundraising. After all of your meetings and the big large room discussion, we realized like goal number 1 should actually be your freedom to operate an IP, because that will unlock fundraising. Right. And we're like, oh, wow, that's big. Like now we see that. That's goal number 1. At the end of the day, our mentors will self-nominate to work with you given your goals and what your priorities are and the objectives we set. And so maybe our IP expert will go, I know I can, they're working on IP. This is my wheelhouse. I can help Matt get this done in the next 8 weeks. Yeah. And then like they'll raise their hand in order to then work with you. Wow. Or, maybe it is fundraising and our VC folks raise their hand to be like, I can help Matt. Yeah. We can get them there. Yeah. But like they'll self-select, and then based on who works with you, you get to meet with them once a week or every other week for an hour or 2-hour call until everyone comes back together 2 months later. Wow. And so that's kind of the communication structure.
I love that, Jack.
And that's a lot more than just communication.
Because I feel like this self-nomination structure makes it like that mentor actually, first of all, wants to, and second of all, has the technical capability to solve that problem. Because like, as we mentioned before, like maybe in some of the more like generalist like incubator, like the mentor might not even have interest or have the technical capability. So that mismatch and misalignment can not be of help, but maybe be a deterrent sometimes. Yeah.
No, 100%. I think it is all about fit. CDL as a program is, because we're a nonprofit and no cost, and the mentors are all volunteering, everyone here is choosing to be here. There's no forced hand. Yeah. And there's no misaligned incentives either, right? With all of that in mind, it is really just about how to add the most value.
For sure.
Like, companies stay with the program because they're getting some. Companies sometimes leave the program because they're like, maybe there isn't a fit with the mentors and what their challenges are. Yeah. And maybe and that's okay. But it is really just about finding that right fit. So having the self-nomination is important there.
Jack, let's talk about the inception of the cancer stream.
Sure.
Walk us through, because I know the cancer stream, unlike the other streams, was a newly architected stream. Yeah. And you were behind the architecture of things. So walk us through that whole journey from 0 to 1. How did you bring the cancer stream from just an idea into a stream that has a lot of vibrant companies right now?
Oh, thanks. So again, good questions. As I touched on, CDL has its various streams. Across CDL, so the cancer stream just came to the end of its first proper year. So it's one of our newest, if not our newest stream across the whole network. Yeah. Prior to that, there were many health focus areas within CDL. We had a stream focused on just therapeutics. We had a stream focused on diagnostics and biomedical engineering innovations. We had computational health, like a very AI-driven one. We had health and wellness, like consumer-facing. So we had all these health areas popping up. But all of those are very technically focused. Yeah. Therapies broadly, like a very technical focus, biomedical engineering, like it is very a technical specialty to get into that room. And so that's one thing to keep in mind. As that was happening, the Canadian Cancer Society and CDL had mutually, over a long period of time, worked together to build a partnership around trying to move innovations in the cancer space forward more quickly. Ultimately, we need these things, these ideas, all the research. Cancer research is so well funded. Yeah. But why are patients not seeing that sooner? Yeah. The benefits from that. And that was the question that we wanted to try and solve or answer and kind of move the needle on. And so the partnership between CDL and the Canadian Cancer Society comes together around this idea of moving innovations in cancer forward. At first, it was, let's just cherry pick all the cancer-related companies that lived in all of those health streams I mentioned and try and just help them a little more.
Right.
Can we give some extra programming? Can we introduce them to cancer-specific folks?
Right.
Like, what can we do here?
Yeah.
That was a nice trial run. We realized there was some appetite. They started to get the inkling of there's appetite for cancer-specific focus.
Yeah.
I was approached with that as an idea, being like, what could a whole thing around cancer look like? We hadn't really had an indication-specific focus area before. Like, all of these had been technically driven, right? Diagnostics have their own set of tools and tests and regulations. Therapies have their own tools and tests. All these things are very technically driven. And then cancer was like, should we reinvent a little bit, reimagine how we do a stream? What's the reason these people are coming together? It's a bit more impact-driven. It's a bit more, maybe sentimental or heart-driven.
Right.
There's a different reason that people want to support cancer than they do other things traditionally.
Yeah.
And so they came to me with this idea of like, what could cancer look like? I then built out a big report, a proposal for like, here's what a whole stream dedicated to cancer could look like. This was last year in kind of March, April. And they got approved, like, let's do it, let's launch a whole new stream. They let me take it on. I'd be on, like, they planted the idea of, hey, do you want to write a proposal for this? I kind of took it and ran, and I was like, absolutely. And then they, gave me the opportunity to take it on, to actually build it once that proposal got approved.
Yeah.
So I spent right around a year ago, a little more than that, starting kind of last June, building out a whole room for just cancer. And that room, as I touched on before, is a marketplace, right? It's advice givers and advice takers. And so not only was it go find the coolest cancer companies that can really make a difference, it's go find the right people to surround them with to actually give them that advice.
Yeah.
I was pretty new. I was very green to the cancer space. I dove in head first and tried to learn everything I could about what are we actually trying to accomplish here? Yeah. What does moving the needle for patients look like? It's not just discovering a new cancer treatment. It starts with, like, how do you catch things early? How do you confirm that they're there? Yeah. How can you give people new treatments? How can you make sure they're on the right treatments? How can you help them manage their whole treatment path? How do you help them after they are a survivor and, like, once they're cured? Like, there's a whole spectrum of care. Yeah. And so trying to build that as this is now the focus of the area. It's across the whole spectrum of cancer care. Yeah. We want to help move the needle and support companies that are making a difference across all of this. Not just one technical area, push the whole area forward. So build a whole room of mentors, recruited all of the companies. I think we got 150 applications last year for the cancer stream, which was the most of any health stream and the most any streams had in their first year, which was cool. Yeah. Picked 20 amazing companies to carry forward. Yeah. Just finished the year. They had 10 graduates of the 20. And they're amazing founders that are all kind of doing something super unique along this kind of continuum of care. And that's, I guess, the inception and a little bit of the journey. The one added piece that I think we pushed forward, or I helped to really prioritize in the cancer stream that hadn't been seen at CDL anywhere, and to do with this mission alignment is like, why are we all here? Can we start tracking new ideas, new numbers, new metrics about what does success look like? It's not just dollars raised, which is the CDL kind of way. Mm-hmm. Patients accessed. How many new patients are getting an innovative treatment or new type of care? How many new patients are we reaching with innovation that weren't able to get it before? Those are the numbers we're looking for CDL, as well as the traditional, like, how much can you raise? Can we build a big business? But success looks different in cancer than it does in any other in other fields. Yeah. And then the last piece is the incorporation of the patient. Cancer has one of the most, cancer across the board has some of the most vocal and prominent advocates as patients. Yeah. Being a patient and a survivor is really important, and their voices are prominent in the field. Yeah. I believed, and a lot of us, with support of the whole community, that they need to be incorporated earlier. Like, innovations need to be built with the patients in mind, not just with the science in mind and with the dollars behind it. Yeah. And so I helped to bring in patient advocates to join us along this journey who know innovation in the space, who are either survivors or current patients with cancer, and can come in and advise these companies as well as a new type of voice that they can hear along the way, because it is ultimately them who will be getting this, like who can be representative of the end user. It's almost like customer discovery.
Yeah, for sure.
But it's, you know, it's just so meaningful to have the patients represented when I think it's often overlooked in the innovation space across the board.
Yeah. Wow, that's awesome. What was the most, would you say, the most rewarding part? Like, it's been a year, like the 10 amazing companies that graduated.
Yeah.
What has been the most rewarding part of this journey, building out this new stream for you?
Well, I think that's a good question. It's hard to answer with one thing. It's the people. Like, ultimately, these aren't companies, they're founders, right? They're people pushing something forward, and hearing their stories around why they're doing this has been so meaningful. Like, everyone is touched by cancer in some way.
Yeah.
And that is such a core driver for all of these founders. And so being able to support them as they try and do something about that has been so meaningful, and seeing their growth, both as people, as companies, has been amazing. I think the mentors on the same side, like what's brought them in to give back to this is really specific to, like, everyone is touched by cancer and they want to help make a difference there too. The most meaningful, and people is at the core of what's been meaningful. I think people derive meaning from people. I think it's hard not to. But the incorporation of the patient, like we had an amazing advocate kind of be our champion this year. Her name is Robbie Spring. She came in young, mid-30s, recently diagnosed with breast cancer, came into our session 1 as like right after her first treatment, a week after her receiving her first treatment. And then by the end of our session, she was in remission and a survivor, and like championing why the patient voice needs to be a part of the innovation process. And like seeing that has just been really meaningful as well.
That's awesome.
Yeah.
Wow. Let's transition into the most recent batch of graduates
let's do it.
From the cancer stream. The first company I want to touch on is Encapsulate Bio.
Mm-hmm.
So their flagship product is Tumor on a chip.
Mm-hmm.
Tell us about what's the significance of putting a tumor on a chip.
Yeah.
Why is this so impactful?
Yeah, good question. Encapsulate is they're a great company. I'm going to say, you're going to hear a common thread of, I love these founders. They are the most incredible people. Armin and Layla, big shout out, Encapsulate. So they've developed a technology where they take a sample of a patient's tumor.
Yeah.
Every time a patient gets diagnosed with cancer, there's a biopsy done, a tissue biopsy done of their tumor. Those are often stored in biobanks to like analyze and do further analysis on to confirm the type of cancer, the subtypes, anything you need. They can take a really, really small piece of that they're not going to like risk not having enough for other things. Take a really small piece of that,
right.
And they figure out a way to encapsulate these tumor samples in what's called microspheres. They have a new way of packaging these samples of a patient-specific tumor, and then they lay out that patient's cancer in these spheres on a chip in sequence. So they'll like lay them out in a specific way, and then they've automated a way to run treatments against those cancers. So you can see what works for this patient. So let's try, let's say you have cancer type X.
Sure.
Let's take a piece of that for a specific individual, take a piece of their cancer, their tumor, put them in order on a chip, and try what's the normal standard of care.
Yeah.
If you get diagnosed with X, you're prescribed a certain treatment line. Let's try it. Does it work? Because often it doesn't. And that's the problem that a lot of people face, is like, there is no one-size-fits-all approach. We're on the road to getting very personalized, and this is a step on the way there. But let's try certain courses of treatment to figure out what's actually the best one for you as an individual patient. And then, so we don't have to go through 5 different treatments to get to one that works. We'll know which is the best one to try first, and then if that works, can we try some things in combination? What should we try second, just to give it a better chance? And so they've automated this way of like packaging tumors into and then testing flows and courses of treatment specific to one person, and they've automated the whole thing to be quite fast.
Wow. I'm really curious about this whole concept of a biobank. Before Encapsulate step into the game, how are hospitals or institutions managing or dealing with the biobank of these tumor cells? Are they also running like similar like analyses on tumors?
So again, I can't speak specifically to any given system. I know that the typical analysis done on a sample like this is pathology. So you take a slide of it, you look under the slide. A pathologist would look under the slide and go, here's the type of cancer we have. You stain it with different contrast agents. You maybe screen it for certain targets or certain features that would help define the cancer, all just to try and understand more about this cancer so we can better treat it. That's the goal, is understand more so you can treat it better, and that's done at the hospital level. Tests like Encapsulates, and there's others that we had this year as well, doing different but similar goal, different way of getting there. Of like, can we take a piece of a tumor that's already been sampled and just provide more information to better direct care, right? We want patients to get the right treatment first that will give them the best chance at actually beating this cancer.
Right.
And, that can start with just what approved drugs will work best. Let's go backwards. If you were to create a whole new drug, what would work best?
Right.
Like those questions. But those samples are held onto, and doctors can order tests. The doctor orders the test. Be like, I want to order Encapsulate's test for my patient to figure out what would work.
Got it.
And they can do that for any number of tests.
Got it.
Yeah.
And a big advantage of Encapsulate is like, it's the preclinical, like as you said, like you can test different like potential drug and like see which one has the highest efficacy, whatever. How important is having that preclinical modeling?
Yeah, good question.
To the whole like tumor drug development cycle.
Yeah, I think this is greater than just oncology, right? This is just across the board. Model systems for like how we actually model disease before putting it into people. Before we put any drug into a person, we try and get as close to being sure that it's going to work.
Yeah.
As close as possible. We historically, in the grand scheme of things, have been pretty bad at that, in my opinion. Like there are so many bad model systems out there. There are so many diseases that don't have a good model. We've used mice forever as a model system. Like test it in mice, will it work? We can give mice any disease in the world, like play God with mice, and then cure them of everything. We literally are so good at curing mice of disease. Yet like 80% of drugs still fail when they get into people. Why is that happening? And so something like this, Encapsulates tech, is another step towards like, if you use this, it should give a really good understanding of how it will actually work in a human.
Yeah.
It's still not perfect because our bodies are so complex. Treatments go through, they get processed by the liver, they get processed by the skin, the blood. Like it has so many different layers to it. But in terms of just saying, will this work? This is pretty darn close to like as good as it gets, because you're literally taking a specific patient's tumor. Yeah. This isn't just, oh, you have breast cancer, let's give you what breast cancer patients get. No, you have this is literally your cancer, let's treat it and see what works.
For sure.
And so we're steps towards I think there's a long way to go across every disease. Like, you talked about neurological disease, like anything in the brain that's been elusive to treat. It's because we don't know how to model it. There's no good way of predicting outside of just giving it to people, which is super risky. And so we're working on it. I think there's a long way to go, and there will be a lot of companies that I hope to support, and CDL can, and other ones can.
That's exciting.
To get there.
I know one of those chips got sent to outer space.
Yeah, a bunch of them did from this company, yeah.
Why is space so good for analyzing tumors?
Sure. Encapsulate won a grant with NASA in the ISS National Lab to send their chips in cancer to space. Yeah. And why? Why is a good question. They, for science's sake, they didn't really know. They had ideas. What could this do? A lot of it was exploratory.
Right.
And so they were kind of like, what can we do given the environment of space and its different features and properties that, like, what we want to learn what we actually can do up there that's different.
Right.
I think they learned that like the lack of gravity and microgravity environment that exists in space and on the space station. They found out that cancer grows a lot faster. So it's typically about 3 to 4 times faster for the disease to progress, for cancer to grow, in space than on Earth. Why? I don't have the answer to that. They might know. It has definitely something to do with the environment. But they sent a bunch of samples up there and started to test their drugs, and they realized cancer was progressing significantly faster and saving time. That time even sent up and down is still a much shorter period. And so maybe there's a world in which regular flights going up and down to space to like test more quickly on someone's tumor samples can be a reality. But it's pretty interesting. It's still very early days. I think what space can do, what the environment of outer space can do for us here on Earth is actually super interesting, and we're really on the forefront. But there are people working to figure that out.
Yeah. On a different field, like I've heard of companies who like collect certain like organisms or like certain like materials in outer space.
Oh.
Yeah. So like
space mining.
Yeah, space mining and like taking it back for like analysis.
Yeah.
So I mean, with the maturation of like space, driving down the cost of like space travel, like
CDL Space, we have a space stream.
Oh wow!
Did you know that?
I did not know that.
Yeah, we have CDL Space. Chris Hadfield is one of our champions for that. Of course, commander. Wow. But yeah, the whole space stream here at CDL is built upon the idea that the cost per kilo of space travel or sending things to space is dropping exponentially, especially with Starship soon to be hopefully online in the next few years. What will that unlock? That's a whole new economy that is going to exist because you can get to and from space a lot cheaper.
Yeah.
So who knows? I think space mining, like what can we find out there to bring back? What can we send up? What can we send up that otherwise wouldn't have a cost argument to send up?
Yeah.
And vice versa. What can you bring back is interesting. I know right now there are a company called Varda Space.
Okay.
That is a contract worker service provider for pharma, where they do protein and crystallization in space to create new drugs. That's what they're trying to do. Create new drugs in space, because the way proteins crystallize and connect to each other is different under microgravity than it is here.
Yeah.
How? That's still being figured out. I mean, I don't know too much about the company other than their purpose and what they're doing.
Yeah.
But again, things like that are being explored, which is pretty interesting.
For sure. Let's switch gears to another company.
Yeah, sure.
Loved Encapsulate.
Yeah.
Let's switch here to Brenus Pharma.
Yeah.
I know we were talking about this.
Yeah, we were chatting about this before.
Before we went live. Just, it was so freaking cool. I'll let Jack explain what Brenus Pharma
is another one of the great companies we had graduate this year. They're a French biotech venture working on cancer vaccines. Cancer vaccines as a concept is actually somewhat, it's like lived a little bit. It's not new, but it's a familiar idea that initially caught some steam some years ago, and then I kind of saw a lack of success, so it kind of fizzled, and just recently came charging back with some good data across the board of like what these things can do.
Yeah.
But if you think of the concept of a vaccine as a whole, not cancer-related, vaccines, you take a disease, whether it's a virus or a bacteria, well, I guess virus, take a virus, try and take a shell of the virus and provide that as a vaccine to train your immune system to see it when it comes in. So you're ready to fight it off the moment it arrives. Mm-hmm. You're trying to pre-train your immune system to see foreign invaders. We're trying to take advantage of the same system for cancer with these cancer vaccines. So can you train your immune system to recognize cancer cells and fight it on their own? Instead of needing to get chemo or treatment, can you train your body to see cancer itself and then fight it and attack those cells? Our immune system is better at killing anything than drugs are, frankly, in my opinion. Like if you can act, the full weight of your immune system can do so much.
Yeah.
And so how can you, weaponize that against cancer in the best way? And that's what the goal is here.
Wow.
What they're doing that's really interesting is like essentially super mutating cancer cells. They're taking a certain type of cancer, they're treating it with every treatment that could be ever prescribed to that, and then trying to make the cancer survive. They're trying to be like, which is the strongest cell? Keep mutating. Be this super cell, and that, if that actually happened in your body, would be, you can't kill it. Like this is the cell that would be the most deadly because you've tried to treat it and it keeps surviving and evolving and surviving and evolving. And as it does that, it presents new features on the outside of the cell. It presents new receptors, new structures, new things that your body can then start to look for.
Right.
And so they super mutate these cells, they create all these outside signatures on the cell, and then hollow it out and give it to you as a vaccine. And then your body can take that in, a harmless shell of what could have been really dangerous, and be like, okay, here are all the things on the outside we're now going to look for. We'll be trained that if we see any of these signatures, not just all of them at once, but any of them individually, we can go attack.
Wow.
And that's the goal, is as the cancer starts to mutate itself, Because most of this, when you treat cancer, most of the cells die. That one or two or a couple that linger evolve. Those are the ones that cause problems. And so if you see as it evolves, we can still see it and attack it with your own immune system. That's the goal.
Wow.
It's super cool.
No,
I think it's like
it is.
I love the concept. They're showing some great data.
Yeah.
They just won like the best biotech company in France award.
Wow.
They're awesome. I love big fan of this company. And they were great to work with.
I'm not a vaccine expert.
Mm-hmm.
What is the process of hollowing out a cancer cell? What's the process like?
Well, I mean, I don't know exactly their process. I'm sure they have a novel way of doing it. But essentially, for a cell to reproduce, it needs all of its genetic material. You need a nucleus. You need all the proteins in there that can like reproduce all of what it needs. Essentially, if you just go in there and like literally take that out, whether it's like microneedling or I don't know how they do that part, but you can make a shell of a cell, right? If you just get rid of all the stuff that could allow it to reproduce, then it just is innate. It's like a single cell and eventually it'll die.
Yeah.
And so just get that out.
Wow.
Hope for the best.
That's so exciting. That's so exciting.
Yeah.
Want to pivot to another company?
Yeah, let's talk about man. These companies are my absolute favorite. I love them all. So they're all doing such cool stuff.
Yeah, on the way to here, my dad and I were talking about like the importance of early stage screening.
Yeah.
And I know one of the most common ways of doing it is like liquid biopsies.
Yeah.
And then one of the companies, Oxford Cancer Analytics, have shown great results, especially in the domain of lung cancer. Mm-hmm. It can detect lung cancer 4 years earlier than the gold standard. I guess my question is, liquid biopsy has been with us for quite a while. It's nothing novel. Mm-hmm. So what is so unique about Oxford Cancer's approach to liquid biopsy that makes it achieve such great results? Mm-hmm. What's the twist there?
Yeah, good question. So Oxford Cancer Analytics, OxCan for short, a liquid biopsy is a blood-based test. Instead of having to take a physical piece of your tumor out to analyze it, take a blood test and see what you can find. What's unique is that for so many cancers, there's no signal in the blood, or that there wasn't. We didn't know what to look for. Right. Like blood-based cancers, you can see it. But solid tumors, these like literal growths, they're not floating around. They're stuck. And so what can you do to actually catch those early? The familiarity with liquid biopsy, there's been a bunch of companies that raised a ton of money around this promise of detecting cancer early through the blood, through whatever their methods were. What's been tried, companies like Grail, companies like Freenome Foundation, they did it on the idea of next-gen sequencing. So you sequence the genome of cancer things floating around in the blood. So you detect, there's a couple of different things that have been tried. Cell-free DNA or circulating tumor DNA. So at a certain point of a tumor's growth, it starts shedding pieces of DNA into the bloodstream. Yeah. And by sequencing, taking a blood sample, sequencing it all, you can see those little fragments. And that's what's been tried. You may have X cancer, go get further testing. That's the idea.
Right.
Turns out, though, like cancers don't, by and large, and I'm going to generalize, but most cancers don't start shedding enough DNA until they're late stage to be reasonably detected, right? Wow. So that's the problem is, we can catch all these cancers, but they're still catching them at stage 3 or 4 because the thing they're measuring is only found in a high enough concentration when the cancer itself is late. Yeah. And so then people started to ask the question, okay, what is actually present at the early stages? Yeah. What changes? What can you measure? Mm-hmm. And that's what OxCan figured out is it's protein-based. They do an assay that's looking for proteins, not DNA, not circulating tumor DNA, not cell-free DNA, not any like sort of DNA-related structure, but a different protein signature when cancer is present. And so they're doing amazing work on the back end behind their whole, test is the world's largest like protein biobank for different cancers. Right. They analyze tons of samples to develop independent signatures for different cancer types. Right. So lung cancer has its own signature of how the proteome changes. Yeah. Breast cancer will have its own signature, et cetera. And they're trying to start with the cancers that are the most deadly. Yeah. Lung cancer is so deadly because it's caught late. Yeah. By then identifying this fingerprint, this signature that lung cancer, this protein signature it presents in the blood, they can then run a blood test against a panel of things that it could be.
Yep.
And then use that to detect cancer early. And so they're looking for something different, and then they found that they found a signature for a certain type of cancer that is like representative of really, really like early stage lung cancer.
Wow.
And so by looking for something different that's actually present, and then building a specific series of biomarkers against that are specific for that cancer type, you can look for things. And so you can run a series of tests on different cancer types with the different fingerprints that they have, different protein fingerprints, to be like, do we have lung cancer? Yes, no. Breast cancer? Yes, no. The goal is to expand across all different cancers to try and catch them early, because ultimately a cancer caught at stage 1 with an existing treatment today has a better chance of being treated successfully and survival than a cancer at stage 4 with the most innovative treatment in 5 years. Like,
for sure.
No matter what, almost always, I'm not going to say always, but almost always, the quality of treatment means a lot less. Like the innovative, how new the treatment is, how cutting edge, means a lot less than how early you catch it. Outcomes are way better when cancer's caught early. Like, that is the biggest indicator of survival, not what treatment you'll get.
Yeah. For sure. Wow. Very quick. So it's like, genes and proteins. Depends on what you're looking at.
Yeah.
And I mean, it seems like Oxcan figured out a way.
They asked the right question of like, what is actually going to be there early? If we're trying to catch cancer early, if that's the problem we're trying to solve, we need to look for something that can actually correspond to that problem. And then they did it in spades, because now they have this huge defensible back end of protein signatures that they can continue to expand upon.
Yeah, that's awesome.
Yeah.
Let's pivot to the last company I want to talk about. Super exciting. Realyze Intelligence.
Yeah.
I know there has been a study, a breast cancer clinical trial that used Realyze's platform to match, patients with that specific criteria for breast cancer, like age criteria, whatever, with the company actually conducting the clinical trial. So just tell us about the importance of this matchmaking ability of Realyze. Why is it so transformational? And I guess how were patients matched with clinical trials before AI
before a platform
approach
like this? Happy to. So that, I think I might start with the last part of that question, because really what Realyze has done with their product is a almost like silly, obvious solution to a massive problem. Right? They were like, 3% of patients are enrolled in clinical trials. 90% of clinical trials fail, or 80 to 90%, because they don't have enough patients get enrolled. That is a huge problem. Clinical trials for cancer patients can be the difference maker in like actually getting something that works for you if everything else has failed.
For sure.
Yet they're not nearly enough patients are actually getting access to these, especially in rural settings or any non-major centers. The traditional way that clinical trials were enrolled for, it sounds so antiquated, but it's literally like an oncologist that's treating a patient will just have their own list of like, half the time it's top of their mind. They just know a certain space well, or their health system will be like, their hospital will be like, hey, we know these ones are here. And they'll be like, oh, I know that this patient could be eligible for these trials. There are so many new trials emerging every day that's an impossible task to keep up with.
For sure.
So the alternative for that they typically would do is they'd order a analysis to be done, being like, here's my patient, here are their criteria and everything about them and their cancer type. Can we like outsource, or like just as a service, like kind of manually brute force it to like try and match make them? And then we have to reach out to those coordinators and everything. And it's a super brutal process that the oncologist, who's already overloaded, doesn't have time to handle. And so that's why these things were so low. And what Realyze did was, when they built bespoke LLMs that can analyze two sides of data: the entire clinical trial database on clinicaltrials.gov and every government level 1. They go in there and they're always live updating every single clinical trial for every indication. So everything for breast cancer, every type of breast cancer, subtypes. And within a clinical trial, there's what's called inclusion and exclusion criteria. So certain features about the patient that say you are eligible. If you meet these and don't have these, then you are eligible.
Got it.
And then it takes, on the other end, it plugs into a hospital system to be like, everything about the patient that comes in, both structured and unstructured data, so handwritten notes are included, doctor's notes, meeting notes, plus the more official stuff of like height, weight, sex, cancer type, any other features. This is all built. They analyze both sides and then go, okay, based on that, here is, patient comes in. Here are the 8 clinical trials they're eligible for. We're going to rank them by like fit, or like maybe there's more, maybe there's 30, and then just presents that immediately to the doctor and being like, as they come in, here's what you should be looking at if you want to see clinical trials. Right. And then they can just start making those matches happen. Wow. So it's almost like, obviously this makes so much sense. It's such a clear solution. And they make new models for each cancer type has its own LLM built just for that, so that they can like roll those out. It's great. They're doing some great stuff.
Wow, 3%. That's a shocking number. That's a shockingly low number.
Fact check me on that. But it is really low. I think it's something like only 3% of patients are enrolled in clinical trials.
I'm just thinking, like, what's the, in terms of like incentive alignment, what's the incentive for a oncology patient to be enrolled in one of those studies? And understanding the incentive, how could we leverage that?
Yeah, so the question is like, why would you want to do that? Why would a patient say yes to a clinical trial? Why would a patient
voluntarily say yes to a clinical trial?
Well, I mean, the sad answer is there's nothing else is working. Like, they've gone through no one would just jump into a clinical trial as their first guess. But if you try every single thing and nothing's worked and your cancer is still progressing, then you're going to need, no one just wants to say like, that's it. And so what else can we try? There's so much good research being done to try and overcome the fault, like where everything else has fallen short. And so if you can match the newest science and like show that, hey, this has potential, everything else has failed, give it a try, because it wouldn't have been approved yet, then that's like the why. It's just to give more hope. And then on the other side too, like there's compensation structures. Oncologists would want to do this to just give their patients a better chance. If it works, then maybe the drug can get approved, and then that can stop the next person from having to go through all of those failures because it's now in the rotation, right? There's longer term things that can come from that too. But ultimately, it's out of necessity, I would say.
Got it. This kind of reminds me, I'm not exactly sure it's part of the graduating class for CDL, but there's this company that analyzes like failed organs.
Oh yeah,
that's part of CDL.
They graduated last year, I think it's called Realyze Bio.
I mean, it's such a cool concept.
I mean, I worked with Greg as well. He was fantastic. They came through, I guess, they graduated 13 months ago from here in Toronto, our biomedical engineering stream, and they take organs that were, bound for transplant or not, like diseased organs that would otherwise have no home. Like you can't give a liver that has gone through cancer treatment to someone who needs it because that liver has been damaged. But, maybe that liver has a certain disease that you can actually test drugs on. And so they've developed a model to keep organs alive, like a perfusion system to keep organs alive in different ways. And then you can, as almost like a service, run different tests on these organs to be like, this is back to the model system. This is a new way of getting closer to, will this actually work in a human? Can you run them in these organs that are actually human organs that are still alive and like test it? Because they're available, and otherwise these organs are just going to waste. Like there's no use for them. There's never been a use for them.
We always had these like resources. I don't want to use the word, but we always had these assets and resources beside us. I just think like it's because of the advancement of like analysis and like AI and stuff like that. We start to like realize, okay, these resources and assets we can use for a lot of powerful things.
Yes, absolutely. It's cool. If given the ability to analyze something, like a new tool that unlocks, it's not just, you don't just do the same tasks, right? You can have a whole new set of things to look for if given a new thing to look with. Right? So AI can process and analyze things in a different way. What new questions that we've never been able to ask because we couldn't handle it?
For sure.
And it's a little away from the organs, but I think it's just a sense of like a new tool and a new way of looking at things. You can ask new questions.
Wow. So amazing companies.
Dude, they're
so exciting.
And so many more too. I mean, it really has been such a treat and an honor to work with these companies.
I want to kind of transition into kind of your personal life and like what's kind of in the future for you? I know before the camera went live, I was asking you, okay, what's next for Jack? Exciting stuff. I want you to break it.
Yeah. So do you want me to talk about what's next first,
and
then what's coming, or like the story a bit, or?
Yeah. Let's start with why you decided to do a master's, an additional master's in biotechnology, and then we can go with like what's next for Jack.
Sure. Yeah. I think it's a bit of a story of like I found a fit and then kept digging in deeper. And so I was a science kid at UCC and a science kid in my undergrad. I went to McGill, studied pharmacology. Yeah. Initially, I went in just studying science. You don't have to declare until you're there. Yeah. I was like, I thought I wanted to go do med school. I was like, pre-med, this is the path. Like, and then as I got closer and closer to actually having to make that leap, I realized I don't think this is the path. Like, there was something holding me back from diving in all the way. Right. And then I started gravitating towards business-oriented or non-lab related courses in my undergrad. When so many things were like, go in the lab, do this research, I was like, why not do, the industry course? So pharmacology was kind of this, the closest to the industry, to the business side of science within the science undergrads that I was interested in. So I just kind of gravitated towards it throughout my time there, and then declared when I needed to. And then leaving McGill, as I was kind of in my final year, I was like, what's next? I faced the age-old question of like, I have no idea what I want to do. What do? I don't want to go to med school. I don't know what jobs are out there. I found CDL very fortunately through a story of its own. But I found CDL. I started interviewing here. I got, I was applying for a summer position, an analyst to help bring in the next wave of companies. I didn't know really what I'd be doing. Frankly, I didn't really care all that much. I knew I wanted to be in the building because I found it really, really exciting. I wanted to be surrounded by the coolest people, the coolest companies, and just be a part of what I thought was something really exciting and learn a lot. At that same time, right as I kind of got exposed to CDL and started to learn more about what they offer and why it started to excite me, I found a master's program down in New York that a friend of mine was in. That was a joint master's in biotech and entrepreneurship. Got it. And I was like, wait, this whole world of business science, that's actually a thing that is being officially studied and officially supported, and there is a world there. And in hindsight, I'm like, that world is massive now that I've been in it for a while, and I had no idea. It's like there's a whole blossomed ecosystem here that there's so much opportunity in. I just didn't know it at the time. In the same week, literally 2 days apart, I got a summer offer at CDL and I got accepted to my master's. And I was like, this is perfect. I'll do the summer job and I'll go to school and keep studying and chasing that dream of this innovation in science and healthcare. This felt like such it felt like such a natural fit. And so I said, literally click, yes and yes, let's do this. And then I spent the summer at CDL and I loved it so much that I didn't want to leave. And so I went and started my master's and just switched to part-time. And so I was working part-time throughout my whole master's at CDL and supporting the companies and trying to find the next batch of companies and kind of taking what I learned in the classroom in biotech and business and entrepreneurship, taking that to my companies, taking the problems they were facing straight back into the classroom. That's being perfect. Hey, I just spoke this morning. And then there was kind of this great mutual growth. And I think I learned the fact that I was doing both. I learned so much because I was literally taking it back and forth. And then I left my master's to lead the cancer stream here, and that's kind of what's continued to keep that ramp track and momentum going. Through all of this, I think I realized, and through CDL, I learned so much. CDL is the best education I've ever been paid for. It's just the greatest thing ever. I've learned so much and met the most incredible people, but it's still only increased my itch to actually go build something. I've realized I want to try and take a leap. This idea of impact and doing something that's really can benefit people and help people in the health space has been always on my mind. I think that's what drew me to med school initially. That's what excited me here. There's all these people doing something that's really, really good. And now I've realized I wanted to go build something, and I've felt that for a little while now. And so through the experience here, I found a organization based out of the UK that they launch companies. They're a venture studio that builds and launches companies that solve problems using science. So healthcare, agriculture, climate, they build and launch companies in this space. They have a great approach. I quickly became a huge fan after I first found out about them. So many other companies have come through CDL that I was like, what are they doing right that no one else is doing? And I was like, they're onto it.
Yeah.
They, in the last year, they built and launched a PhD of their own in partnership with 30 plus schools around the world to try and marry academia with the venture building process. Yeah. Because the best science in the world is being done in academic labs. That is a truth.
Yeah.
However, the science being done isn't designed to solve actual problems, traditionally in academia.
Yeah.
So much good technology is being developed, and then people go try and push it out of the lab, being like, where can this go in the market? And that's what CDL is actually here to solve. We take good ideas and good scientists and go, here's where you should actually apply yourselves, and here's the problem you should try and solve. They're trying to flip that on its head, being like, let's figure out the problems that need to be solved, not the ones that need to be solved using science, and then go do that science with academia. But start with the problem, because by starting with the problem, not only will you have science that needs to happen and make discoveries that need to be made, but also a problem being effectively solved often, if not almost always, leads to some market incentive driving that too. If you solve a problem well, people will want to pay, and
for sure,
it will actually make money. And so they're like, there is a world in which these things can happen together, and academia needs to be behind it. So they created a whole new program to teach their method of problem first innovation building, and finding the problem, figuring out what's the state of the art, what's been tried, what's failed, and then launching, and then going to do that science to create a company at the other end. And so it's like a new PhD where you get trained on their method of founder school, problem identification, go do the science to solve that problem, and then turn that into a company on the back end. And all these schools came on board. So that's actually what's next for me. I'm going to be starting that in the new year. With this fund, and it's called Deep Science Ventures is the fund. The Venture Science Doctorate is the program. Kind of a guinea pig. There's, I think, 4 students were accepted in its very first year this year, and I believe it's 10. I'm not sure how many exactly, but there's not too many of us going in next year to start.
Wow. I'm so excited to see.
Yeah, no, it's going to be cool. In 3 years, I hope to, be a PhD founder working in the cancer space, which I would have never done if not for CDL and this opportunity. The snowball has kept growing, and I found a niche that I really cared about, and I kept diving in and going deeper, and it's hopefully going to pay off and continue to.
Shout out CDL.
Yeah.
And,
yes, CDL is a fantastic place to be. So much of the opportunity of where things are going for me was created by CDL, and so I'm going to always be grateful for that.
Wow. Yeah. Might have to do a part 2 with Jack.
Catch me in a few years when I'm founder, and I'll tell you what's up.
Perfect. Well, Jack, thank you so much.
Pleasure.
It's been a great conversation.
This has been fun.
Understand your experience with the CDL and just ontology, the cancer space in general. Went through a couple sick companies. So thank you so much.
It's becoming promising, but
Appreciate
I'm excited to see where it all goes. Thanks for having me.
Perfect. Thanks.
Cool.